Have you ever had a moment where your penis simply refused to get hard, and you wondered, even if silently, what is actually going on inside your body? Why does an erection that once appeared instantly now hesitate, fade, or feel weaker than it used to? Most men think these changes come out of nowhere, but the truth is far more revealing and far more fixable than you imagine. I'm Dr. Emily Collins, urologist, and today I want to show you something every man should know but almost no one has ever taught: how to test the real condition of your erection at home using simple, science-based checks that reveal your circulation, nerve response, testosterone status, and overall sexual health without needing a clinic visit. Because an erection is not magic. It is a biological event driven by blood flow rushing into the penis, pressure building inside the erectile chambers, nerves firing at the right time, and hormones quietly signaling your body that sex is still part of your vitality. When one of these systems weakens, your erection is the first place where the problem shows up. And that's why this video starts with the quick erection test, the same kind of self-evaluation I use with my own patients before ordering labs or imaging. What you discover today can help you understand whether your difficulty getting hard comes from poor circulation, slow nerve response, hormonal decline, pelvic floor weakness, or even mental tension that blocks your natural arousal. Many men wait years before facing what their body is trying to tell them, but you don't need to wait. You can start right now, in your own home, using simple observations about morning firmness, temperature changes, sensitivity, the speed of your arousal, and whether the penis feels full or collapses quickly. These small signs reveal far more than you think, and once you understand them, you gain something powerful: clarity. Not fear. Not confusion. Clarity about what your erection is trying to communicate and which simple steps can bring strength back. Before we dive deeper, let me ask you something. Have you ever experienced a moment where you wanted intimacy, but your body didn't respond the way you hoped? That hesitation, that doubt, that frustration, it's more common than you realize, and what you are about to learn can become the turning point. Leave a comment sharing if you've ever wondered about the real cause behind a weak erection, hit like so this conversation reaches more men who need it, and check if you're subscribed so you never miss this kind of guidance. Now take a breath, stay with me, and let's continue into the first at-home test that reveals what your blood flow is truly doing beneath the surface. When you begin examining your own erection at home, the first and most revealing system to evaluate is blood flow. Circulation is the foundation of every strong erection, and what many men don't realize is that the penis works as an early warning device for the arteries and the rest of the body. If blood isn't reaching the erectile tissue quickly, fully, and with enough pressure, your erection will tell you long before your heart ever does. That is why the first home test is simple, practical, and surprisingly accurate: a circulation check based on how your penis behaves in quiet, natural moments of the day. Start with the morning. Before you even move out of bed, notice whether your penis feels full, warm, and firm, or if it feels soft, cold, or slow to respond. A strong morning erection doesn't require desire or stimulation. It is purely vascular, driven by nighttime surges in nitric oxide and the way your arteries open during deep sleep. When those erections weaken, fade quickly, or stop appearing altogether, it often signals reduced blood flow long before symptoms appear anywhere else. This is not about performance. It is about circulation. Next, pay attention to temperature. The penis should feel slightly warm when blood is moving well. If it feels cool to the touch, especially at the base or along the shaft, that can indicate restricted arterial flow. You don't need devices or machines to measure this, your hand will tell you enough. Even a 5-second comparison between the warmth of your inner thigh and the temperature of your penis can give you clues about how efficiently blood is entering the erectile chambers. Another part of this test involves observing how quickly your penis responds to light stimulation. Not full arousal, not sexual intent. Just a simple awareness of how the tissue feels when touched or when a sexual thought crosses your mind. In healthy circulation, the penis swells subtly within seconds because nitric oxide signals the arteries to open. When circulation is compromised, the response becomes delayed, inconsistent, or weak, even if desire is present. That disconnect is one of the earliest signs of vascular decline. You can also use what I call the firmness trace. During a discrete moment, gently squeeze the shaft between two fingers, then release. In good circulation, the tissue refills almost instantly, returning to a plump feeling even when you are not fully hard. If it stays flattened, soft, or slow to rebound, that suggests diminished blood flow and reduced internal pressure. All of this is information your body has been giving you for years, you just may not have known how to interpret it. And none of these signals mean you are broken. They simply reveal what part of your sexual system needs support. When you see the pattern clearly, warmth, responsiveness, refill, morning strength, you begin forming a real picture of your vascular health. And once you understand your circulation, you can take the next step, identifying how your nerves contribute to the quality of your erection and what that means for the strength you can regain moving forward. After understanding what your circulation reveals about your erection, the next essential system to evaluate is nerve response. Many men focus only on hormones and blood flow, but the truth is that without proper nerve signaling, an erection simply cannot happen. The nerves of the penis are responsible for triggering arousal, transmitting sensation, activating the pelvic muscles, and coordinating the vascular mechanisms that make the penis hard. When these neural pathways slow down or weaken, the erection becomes inconsistent, delayed, or less intense, even if desire and blood flow are present. A simple at-home test begins with assessing sensitivity. Not sexual stimulation, not performance, just awareness. Gently touch different parts of the shaft, the glands, and the base, noticing the differences in sensation. You are not evaluating pleasure here, you are observing how distinctly your brain detects each touch. Good nerve function produces immediate, clear feedback. If you notice that some areas feel muted, delayed, or less reactive than others, that can indicate early changes in nerve conduction. This is common in men with mild neuropathy, metabolic changes, or long periods of stress that affect the nervous system. Another useful check involves temperature contrast. Using nothing more than warm and cool fingertips, observe how quickly and sharply your penis perceives the change. In healthy nerve response, the contrast feels immediate and precise because the sensory fibers are active and responsive. When nerve signals slow down, the difference becomes dull or vague. This kind of diminished response often appears before full erectile difficulties develop, making it a valuable sign to catch early. You can also evaluate what I call the arousal spark. This is the tiny internal shift you feel when a thought, memory, or visual cue briefly triggers arousal. Even without full stimulation, a healthy nervous system creates a subtle tightening, a small rush of awareness, or a quick swell of blood into the tissue. If that spark feels delayed, weak, or absent, it may suggest the nerves responsible for initiating arousal are not firing as efficiently as they once did. Another part of this test involves observing how your penis reacts to light, non-sexual stimulation during a calm moment. A gentle glide of the fingertips or even the friction from adjusting your underwear can reveal how quickly the sensory nerves send signals to the brain. In strong nerve function, the reaction is noticeable and immediate. When signals are disrupted, the response becomes slow, faint, or inconsistent, even if the emotional desire for sex remains stable. It is important to understand that nerve response is deeply connected to overall health. Sleep quality, chronic stress, metabolic changes, and even subtle inflammation can affect how the nerves behave. That is why evaluating sensitivity, temperature perception, and arousal cues gives you a deeper picture of what is happening beneath the surface. Once you become aware of how your nerves are performing, you begin to understand how each layer of your sexual system works together and why strengthening one part can dramatically improve the quality of your erection as we move into the next test that reveals what your hormones are quietly telling you. Understanding your nerve response gives you an intimate view of how your body initiates and processes arousal, but there is another system working quietly in the background that influences every part of your erection, your hormones, especially testosterone. Many men imagine testosterone only as the hormone of libido, but its influence extends to blood flow, pelvic muscle strength, nerve sensitivity, confidence, and even how easily you become mentally engaged in sexual moments. When testosterone begins to dip, the changes are subtle at first, but they eventually affect the quality, speed, and firmness of your erection. And just like the previous tests, there are ways to detect these shifts at home without lab results. The first sign to observe is spontaneous libido. Not planned desire. Not physical stimulation, but the natural, almost effortless sexual interest that used to appear throughout the day. Testosterone fuels this automatic drive. When levels are healthy, the mind responds quickly to erotic thoughts, memories, or visual cues. When testosterone is low, that inner spark becomes irregular, weaker, or surprisingly absent. You may still want sex intellectually, but your body no longer responds with the same instinctive energy. Another powerful indicator is morning vitality. Testosterone peaks in the early hours of the day, and your physical state upon waking reflects how well your hormones are functioning. Notice whether you feel alert, focused, and grounded, or if you wake up drained, heavy, and sluggish. Even your morning erection, which reflects a combination of circulation and hormonal rhythm, becomes an indirect measure of your testosterone activity. When it fades quickly or appears inconsistently, it may be a sign that your hormonal baseline is shifting. Strength is another revealing marker. You do not need weights or equipment. Simply pay attention to how firm your grip feels when you squeeze your hand into a fist or hold an object tightly. Testosterone directly influences muscle fiber recruitment, and a noticeably weaker grip can signal hormonal decline. Many men overlook this connection, but it is one of the simplest and most reliable home checks. Your muscles reflect your hormonal environment long before blood work does. Energy levels throughout the day also play a key role. Testosterone supports stamina, motivation, and the ability to stay mentally engaged. If you find yourself losing momentum quickly, struggling to concentrate, or feeling detached during moments that once felt natural, these experiences can indicate that your hormonal system is not providing the support it used to. Sexual performance is not isolated from the rest of your physiology, everything is interconnected. Mood can also act as a subtle detector. Irritability, emotional flatness, or a sense of reduced presence during intimacy can appear when testosterone begins to dip. These emotional cues often show up alongside changes in erection quality, creating a picture that becomes clearer once you know what to look for. When you combine all these signals: spontaneous libido, morning vitality, grip strength, energy stability, and emotional tone, you begin to understand what your body has been quietly communicating. These tests do not diagnose anything, but they reveal patterns, and patterns are what guide you toward the next layer of your sexual health. Once you identify how your hormones are behaving, you can begin exploring the muscular foundation that supports the strength and rigidity of your erection, bringing us to the next important evaluation. Once you understand how your hormones influence your sexual function, the next layer to evaluate is the physical foundation that gives your erection its structure and stability, the pelvic floor muscles. Most men never think about these muscles, yet they determine how strongly blood is trapped inside the penis, how long an erection stays firm, and how effectively your body responds during arousal. When the pelvic floor weakens, erections become softer, lose pressure quickly, or fluctuate during sex, even when circulation and testosterone are adequate. That is why this at-home test is essential. Begin by becoming aware of the internal pull beneath your pelvis. During a quiet moment, tighten the muscles you would use to stop the flow of urine midstream. That gentle lift you feel inside is your pelvic floor contracting. Pay attention to how easily you can activate it. If the contraction feels faint, shaky, or difficult to hold, it may indicate that these muscles are not providing the support your erection needs. A strong pelvic floor produces a firm, controlled lift that you can sustain without strain. Next, evaluate how long you can maintain this contraction. Hold the muscle for a slow count in your mind, noticing whether it remains stable or if it begins to tremble quickly. Healthy pelvic muscles can maintain tension steadily, giving structure to the blood trapped inside the penis during an erection. If the contraction fades rapidly or feels uncoordinated, this may reflect the same instability that causes an erection to rise but not stay firm. You can also test the quick response of these muscles. Instead of one long contraction, try short, sharp pulses. Strong muscles respond immediately, tightening and releasing in a clear rhythm. Weak muscles, however, lag behind or activate unevenly. This delay mirrors what happens during sexual stimulation when the penis depends on these rapid contractions to intensify blood flow and maintain rigidity. Another revealing check involves noticing how your pelvis feels during everyday movements. When you cough, bend, or stand up from a chair, a subtle tightening should naturally occur. If you sense no engagement, or if these movements feel disconnected from your lower core, it may suggest that the pelvic floor is not contributing effectively to your sexual function. Even something as simple as the sensation of fullness during arousal depends on these muscles activating at the right moment. Some men also experience a disconnect between mental desire and physical response when the pelvic floor is weak. You may feel aroused mentally, but the penis fails to achieve the same level of firmness it once did. This gap often reflects muscular support rather than hormonal or vascular issues. Once you observe these patterns, you gain clarity on how much strength your pelvic floor currently provides. Understanding this muscular component is crucial because the pelvic floor acts as the structural anchor for everything else you have tested so far. Blood flow fills the penis, nerves trigger arousal, hormones set the foundation, but it is the pelvic floor that locks the erection in place. Recognizing how these muscles behave allows you to interpret your results more accurately and prepares you for evaluating the final major influence on your erection, the role your mind and stress response play in shaping your sexual performance. As you begin to understand how the pelvic floor influences the stability of your erection, there is one final system that ties everything together: your mind and the way your nervous system reacts to stress. Many men imagine that erection problems are purely physical, but the reality is far more complex. The brain is the command center of arousal, and when it senses threat, pressure, or uncertainty, it shifts the body into a protective mode that suppresses sexual function. This shift can happen even when blood flow, hormones, nerves, and muscles are functioning relatively well. That is why evaluating your stress response is an essential part of understanding your erection at home. Start by observing how your body reacts during moments of tension, not sexual tension, but everyday stress. Notice whether your breathing becomes shallow, your shoulders rise, or your chest tightens. These signals reflect activation of the sympathetic nervous system, the same system that pulls blood away from the penis and redirects it toward survival priorities. If you experience this stress posture frequently, it can interfere with sexual response long before you consciously notice it. Next, pay attention to what happens when a sexual moment begins unexpectedly or when you think about intimacy. Does your mind stay present, or does it drift into worry, performance pressure, or overthinking? Even brief spirals of doubt can interrupt the neural pathway that links desire to physical arousal. When the brain detects pressure instead of pleasure, it releases signals that make it harder for the penis to fill and stay erect, regardless of how strong your circulation or hormones may be. A useful at-home test involves observing how quickly your body shifts between states of calm and states of tension. Sit quietly and place one hand on your chest and the other on your lower abdomen. Notice where your breath naturally falls. In a relaxed state, the breath travels lower, expanding the belly. Under stress, it becomes faster and shallow, rising toward the chest. This shift has a direct impact on erection quality because deep, calm breathing supports parasympathetic activity, the system responsible for sexual arousal. Shallow breathing activates the opposite system, creating resistance in your erotic response. Another aspect to evaluate is how easily you become distracted during arousal. When the mind is overstimulated by stress, work concerns, emotional tension, or unresolved worries, it becomes difficult for the body to maintain the focus required for a stable erection. This distraction is not a failure of desire but a reflection of how the nervous system allocates attention. When focus is divided, arousal weakens, and the erection becomes inconsistent or collapses prematurely. It is also helpful to observe your emotional patterns. A buildup of irritability, frustration, or mental fatigue often signals chronic stress that quietly influences sexual performance. These emotional states can appear long before physical symptoms become noticeable, and they impact how the body responds to arousal. Sexual function requires a balance between physical readiness and psychological openness. When that balance is disrupted, the body hesitates even if the systems beneath it are capable of performing well. When you put these observations together, how quickly stress rises, how your breathing shifts, how easily your mind stays present, and how your emotions influence your focus, you begin to see the connection between psychological tension and erectile strength. This understanding becomes the final piece of your at-home evaluation, preparing you to interpret everything you have discovered so far as you move toward integrating all the results into a clear picture of your sexual health. By the time you reach this point, you have explored every major system that influences the strength, speed, and stability of your erection, and now you can begin connecting these pieces into a clear interpretation of what your body has been telling you. When you understand how circulation, nerve response, hormonal rhythm, pelvic floor strength, and stress all interact, you no longer see your erection as a mystery. You begin to read it almost like a diagnostic signal, a reflection of how well your entire system is functioning. And the beauty of these at-home tests is that they give you immediate insight without guesswork. You now know whether your morning firmness suggests healthy blood flow or whether reduced warmth and delayed swelling point toward vascular restriction. You know how sensitivity, temperature contrast, and arousal cues reveal the state of your nerve pathways. You can identify whether your natural libido, energy pattern, and physical strength align with healthy testosterone levels or if subtle hormonal dips are influencing your performance. You can feel how the pelvic floor either supports or weakens the internal pressure that keeps the penis firm. And you can clearly see how your mind and stress response either open the door to arousal or quietly suppress it. What matters now is recognizing how these patterns overlap. If your circulation test shows slow refill and your nerve response feels muted, you may be facing early vascular or metabolic changes. If libido is low, morning vitality is inconsistent, and grip strength feels weaker, hormones may be playing a larger role. If erections rise but fade quickly, the pelvic floor likely needs targeted support. And if your body reacts strongly to stress or your mind drifts away during arousal, the psychological layer deserves attention. These combinations are what allow you to interpret the meaning behind your quick erection test and understand why your penis reacts the way it does. Each pattern points toward a different path of improvement, giving you clarity about what to strengthen first and which habits or corrections can restore the confidence and sexual vitality you want to reclaim. And if you made it all the way here, it means you are genuinely committed to understanding your own body, not just waiting for change but taking control of it. That alone already sets you ahead of most men who struggle in silence. If this content helped you see your erection in a new way, consider subscribing so you can keep following guidance that actually breaks things down clearly and realistically. Leave a comment saying this message was for me so I know you reached the end and want more videos like this. And hit like if you felt that this conversation made things finally make sense. There is another video right here that deepens this topic and connects directly with what you discovered today. Click and continue your progress with me there.